This video is all about one of the big mistakes that a lot of people make when it comes to fixing their lower back pain, especially in that medium long term. So if you've had chronic back pain, if you've had it for a long period of time, or even relapses over a period of time, then this video is going to really help you make sure that you break through that little mold or that barrier that's stopping you from getting better. Back pain can be complex, and if we don't understand it correctly, then we can get into all sorts of trouble with regards to our rehab. We can think we're never going to be able to lift anything again, and that leads us to poor decisions that ultimately severely restrict our long-term prognosis and the ability for us to properly rehabilitate, get better, and ultimately just get back in shape so you can get on with all the things you like doing without that constant feeling of looking over your shoulder thinking, when am I next going to do that funny movement that's going to catch me out? And rehab and the approach to rehab is such an important part in doing this successfully so we don't get caught out. Depending on which part of the world you're watching this video from, there are all sorts of cultural norms. How old you are, how young you are. There are different belief systems that are in place. And one of the big ones that holds a lot of people back is just the lying down. Lie down and do nothing. And that leads to all sorts of problems. And we're going to dissect that in this particular video to hopefully help you understand things better. But before we get into why load-bearing activities or what we should do about load-bearing activities, I'm going to talk about the most obvious starting point when you injure your back. So ultimately, the overwhelming majority of injuries that affect the lower back come from compression. It is a load-bearing structure. It fails in its ability to load, and that leads to things like disc bulges, it leads to degenerative change, it leads to herniations, all those sorts of things that give us either back pain or sciatic type symptoms. That's where the pain is coming from the lower back and it goes down the leg. And it is compression, it's load-bearing in maybe an inappropriate manner in a one-off instance, or more commonly, a repetitive strain through that lower back. For example, long-term desk-based posture, putting excessive load, and then it finally goes, for example, the herniated disc I mentioned a moment ago. That's what causes the back pain. It is that load. So it is common sense to a certain degree, or you'd be forgiven for thinking, oh, well, I should just not load bear. But that's not how the body works. When you've just injured your back that very first time, yes, we don't want to be doing the wrong sort of things to increase load. We want to understand that we need to take pressure off those structures. We want to loosen off those hips, make sure they're nice and mobile so the back has a little bit less strain on it. We want to do certain exercises that are actually going to decompress, take pressure off that section of the spine so we can help that healing process initially. And as we do that, we make the first forays into rehabilitation, into off-weight bearing exercises so we can start to support and protect that spine, provide it with the control that it needs, avoiding any silly ranges of motion. Particularly one of the common ones is going to be flexion or forward bending. If we use the spine, for example, if we've just injured our discs, it's where we are forward bending and compressing these discs more to try and create space in the back here. We've got loads of videos that explain why that's such a misguided approach and why it really doesn't work to help fix back pain. But that's, again, it's understandable why you might choose to do that. And the avoidance of standing and load-bearing activities when we've got back pain is understandable, but it's not a good thing for the long term. But as we go through, we're holding our spine nice and steady, we're building our core engagement, we're then starting to put ourselves upright again. And this is where we start to get to that nervousness. We're doing load-bearing exercises, we're doing bodyweight exercises, and a lot of people will just say, right, I'm not going to do this anymore. I'm never going to do anything like a deadlift, or I'm never going to do any weighted exercises, any resistance-based exercises, because my back is weak, or something to that effect. Maybe you haven't even got that far. You're still in bed because you think, well, you know, if I get out of bed, my back hurts, and if I stay in bed, it feels okay, so I'm just going to stay here. Now that leads to a vicious cycle, and we'll explain right now why that is. It all comes down to the healing process, and we're going to put this in really simple terms so you can hopefully really get a good conceptual basis and understanding of what's happening. And when we injure the tissues, there's a break. There's two sides of a structure have failed, or a part of a structure is pulled apart, and we've got some failure. In this case, this might be the disc. If we imagine this is the back of the disc here, and compression through the front part of the vertebra here has caused the nucleus, the fluid inside that disc, to drive backwards, and it's ripped through these early layers of the ligaments that hold that in place, part of the annulus fibrosus, and we now have a bulge. And what's trying to happen here is that these tissues are trying to knit back together again and close up and restore some sense of stability. And that involves laying down tissue here to start to bring these two sides back together so they knit and create a degree of strength. The thing with the body, much like bone density, much like your muscles, and the same through your ligaments and tendons, is that they respond to the stress and strain that's going through them. They need that degree of stress and strain to help them organize certain fibers, collagen fibers in the case of the disc or ligament example, arrange those fibers along stress lines so that they can start to provide tensile strength and start to do their job again. And if we're off weight bearing for extended periods, the body will know. It will say, look, this section of the back, the disc here, it's never really under a lot of stress or strain. So we only need to arrange the fibers. We don't really have any major stresses because we're lying down for 60, 70, 80% of the day. So we don't really have any understanding of that extra 20%. We know that 80% of the day, this is the amount of strain and this is the way in which the body is under strain. So we arrange our fibers in that manner. Whereas if we're stood up, that puts different strains on our body. And most of our time to function in society needs to be upright, it needs to be moving around. So that strain of gravity, putting pressure through those discs, those ligaments, those structures that are injured, helps stimulate them and say, oh, we've got a bit of strain here, so let's lay down some extra support here. And we've got a bit of strain over here, let's lay down some support here. And oh, that bit's not quite right, so let's break that down and rebuild it a bit stronger. That's how our body works. It's very, very similar to our bones. We lay down extra mineralization in the bones to help them supply more support, more structure to those bones so they're able to withstand more load. And this happens over time as we're developing, and also it can be maintained as we get older. And we see this process fail in the cases of things like osteoporosis. But if we're off weight bearing and we're not providing that valuable stimulation, then we're really going to be missing a trick. Going forward with your rehab, let's say you're upright and you've managed to get upright, but you are still very, very cautious about doing any sort of load-bearing activities. We have to ask, what is the purpose of our rehab? What is the purpose of our strengthening? What is the purpose of staying fit? And it's the ability to, in an enclosed environment, in a controlled environment where you have control, you haven't got distractions and outside influences. You can control the strain that's going through your body in a very safe way. You can follow instructions, videos, etc., or in-person instructions to do a particular strain or load-bearing activity. Maybe it's a squat, maybe it's a loaded squat, maybe it's a deadlift or some other variation of activity. And that puts controlled load through these structures. Let's talk about the lower back in that case. It's putting controlled load through those discs that maybe have been herniated in the past. And that's creating the stimulation in the muscles and those discs to start to adapt and develop along and create support along those stress lines. That's a very important part of training. If we leave that stuff out in our rehab process, we say, I'm not going to lift anything, then you will lift something at some point. At some point, someone's going to say, here, carry this shopping bag for me, or something's going to fall off the side and you're going to have to go and catch it. Life happens. We can't put you in a test tube, and your back is never going to be in a test tube. So shying away and saying, I'm never going to strengthen up, is really a recipe for disaster, and you're not going to be able to build that resilience that is necessary in your lower back to provide that long-term recovery that you really want and need. So what are you going to do instead? Well, instead we need to understand that some of these structures, like the discs, they take a very long time to build. They take a very long time to repair. We're talking about months to years here, let alone to rebuild them beyond the strength that they had before they went. It does take time. We've got to get appropriate nutrition on board to provide all the nutrients. We need to get those other things correct. But in terms of our training, our muscles will develop an awful lot faster than these structures, these deeper structures. And having the support in knowing that you're doing the right sort of exercises and not leaving out the wrong ones is really, really important, so that you can slowly build up that strength. Because what often happens is, and this is where these people get caught out, maybe even you've been caught out in the past, is that your muscles do start getting stronger, and then you go into the gym and you do some of these lifts of varying sorts, be it a deadlift or a squat or something like that, and it's too much. And that's because your muscles have gone up too strong, too fast, or they've gone at their pace, but those discs and those ligament structures haven't been able to keep up. Because they're slower metabolically in terms of their metabolism. They make change more slowly. So what a really nice thing you can do to help that process is actually throwing in some adaptation periods, some periods where your training just starts to stagnate a little bit. And I use that term, plateau maybe would be a better term. And you don't push on for the muscles for maybe a week or two, and then you make that next step up. These sorts of periods help us let our body adapt to the changes that are going through these structures and help encourage them. And hopefully by this point in the video, you're starting to maybe feel a little bit more like load bearing is something that you can do, but maybe you want to explore a little bit more about how to do that effectively. And that, if you're at that point in this video, then we've done a good job. Now, this is just a little word of warning or a little guidance here, that when you're doing your load bearing activities, those are very safe. We're slowly building up our strengthening work, and over the long term, you're really going to find that you allow the slower structures to start to build a resilience so that you can lift X, Y, Z. And your training, your rehab work, your maintenance and strengthening protocols that you do on a daily basis to keep yourself well and healthy, those will be above and beyond most of the daily stresses that could possibly come your way. That shopping bag might weigh a maximum of 20 kilos if it's pretty big, got a few cartons of milk in there, and therefore if your training is above that, then you're never going to get caught out with something that your body's just not prepared for. Yes, the wardrobe could always fall on you at some point and you have to catch yourself, but those sorts of events are very unlikely, and you'll be in a much better position if we've done some load bearing rehab to deal with these unfortunate events that, as we said, you can't put you in a test tube. So those things are going to happen, but the stronger and more stable you are and the better rehabilitated, the better you're going to do. And if you had no back pain and you've come across this video and you've managed to watch it this far and you've never had back pain, do your rehab, because it's so much easier to keep it going than it is to rebuild it from an injury. And it's important to bear in mind that those sorts of resistance exercises that we've discussed, things like squats, etc., those are very different to then going and doing something like running. That is a load-bearing activity. That is a series of possibly thousands of micro impacts going bang, 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 bang through your spine. And getting into something like that as well, we want to do it slowly and steadily. We want to have a program, a plan of action, and understanding that we're not just going to jump straight in and do 5K when we've just been doing resistance-based work to start with. We want to feed those things in slow as well. And all of this fits together to create a nice rehab approach to build and restore that ability to load bear, which is the fundamental role of your lower back. It's there to allow weight to transmit up and down the body without any trouble in a range of different positions, and allowing for a range of motion. So hopefully this really puts it all together in terms of what you need to do, and it's giving you something to really think about. The importance of these things as we get older becomes more and more apparent, and the better place we are as we get in towards our later years, and that can be that's a very relative statement. It could be 40 for some people, it could be 50, 60, 70 for others, it could be 80 for others. As we're building, the more we can do before we have these problems, the more proactive we can be, the better we can be. And just because you've come out of a rehab process and you're feeling good doesn't mean you should stop there. Continue the work. At this point, it's really a point to push on and continue to be consistent with your approach and steadily make improvement over the months and years and decades to come. This has been a bit of a different video. I hope you found it really helpful, you found it insightful. Maybe it's made you think about things again in a different light. If you did find it helpful and you like these sort of videos to stay up to date, make sure you hit the subscribe button and give us a thumbs up if you did find it useful. And feel free to share this with someone else that you know that might have a bit of trouble with their back, be it sciatica or just general back pain, and hopefully they can learn something new and be given a little bit of confidence that moving forwards and actually reintroducing a bit of load bearing is the right thing to do, because it works and it makes sense when we really think about it properly. And if you've got any questions after this video, leave us a comment in the comments section below. We love to read your comments, and it's really helpful to get feedback from you guys on what you find useful in our videos, so we can continue to produce really good ones that really inform you and help you better understand your back, better understand your body, because that helps you get back in shape for good. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.